So I had always learned that a diet for people with diabetes was about portion control and about limiting carbohydrates. So it was a relief to learn about a plant-based diet, because people following a plant-based diet don't have to do the weighing and the measuring. They don't have to go hungry. They don't have to limit carbohydrates. And I will tell you, this is a really hard concept for healthcare professionals to get their heads around. I know it was for me. You mean people can eat potatoes and not worry about it raising their blood sugar? They can eat bread, they can eat cereal, they can eat rice, they can eat pasta. You know, it's so opposite of what we've all learned. But here's how a plant-based diet works. Most of what we eat on a plant-based diet is carbohydrates. If you think about fruits and whole grains and legumes, and to some extent some vegetables, starchy vegetables like peas and corn and potatoes, these are all carbohydrates. When people change to a plant-based diet and they're not eating all of the meat, and they're not eating processed foods that are full of oils or other added fats like butter, the body's ability to metabolize carbohydrates recovers. And people who previously would eat a bowl of oatmeal and find their blood sugar would go up can now enjoy oatmeal. They can enjoy potatoes, they can enjoy bread, because they're not messing up their metabolism with all these high-fat foods. The beauty of a plant-based diet is you don't have to be focused on portion control. You can eat what you want to where you're comfortably full, and your body will break down what it needs, it will store what it needs, and you can recover your ability to control blood sugar. So there are some people who will still need to count their grams of carbohydrate, and those are people who are taking insulin and are either on a fixed amount of insulin every day, in which case it's really important that they make sure they're getting the right amount of carbohydrates with each meal, or people who take insulin at each meal, people who have type 1 diabetes, or people who have type 2 diabetes and are on rapid-acting insulin at each meal. They will still need to know how much carbohydrate are they eating and match their insulin appropriately. However, their insulin needs may change, and what I've seen with my own patients is they often need less insulin when they shift to a plant-based diet. They might need a little more insulin initially with meals and less long-acting insulin, or they might be able to cut down on everything all at the same time. It's really individual. So certainly if you're somebody who takes insulin, it's really important to work with a healthcare professional who can help you make these adjustments. You know, if you had told me 15 years ago that I would be following a plant-based diet myself and I would be teaching my patients to do that, I never would have believed it. It certainly is not the way I grew up eating, and it's not what I had learned as part of my education. But I changed my own diet because of my own concerns about my health, concerns about my weight, concerns about my family history of heart disease, skin issues, chronic joint pain. And you know, that's the thing that's actually the most surprising to me. I used to have all kinds of aches and pains in my shoulders, in my hips. I used to get gold injections for bursitis because I had such bad pain. And when I changed to a plant-based diet, about, 4 to 6 weeks after making this change, it was a rainy day, and normally that would have just set me off. I'd been worked up for lupus, I'd been worked up for rheumatoid arthritis. That wasn't the problem. And I was taking Vioxx and other pills to control this pain in addition to these gold injections that I would sometimes get. And within a month or so of starting a plant-based diet, I noticed I'm not achy anymore. And that has been true for me now. I've been following a plant-based diet myself for 12 years. And those chronic aches and pains are completely gone. And I have so much more energy and I feel great. I can't imagine going back to my old way of eating. And I now feel a professional responsibility to offer this option to all of my patients. And not all of them immediately embrace this approach or are at all excited to hear me talking about it. But I've learned that I offer it to everybody because enough people have either tried it and been grateful for the information and seen all kinds of benefits, or they've come back to me later. Are you still talking about that plant-based diet? And they're really happy to have a healthcare professional who can tell them how to make this change, how to adjust their medications, and who is doing it themselves. So, I can tell people where to go to eat around here. I can tell them what cookbooks are great. I can tell them what DVDs to share with their family because I am doing it myself and I like to have all of those resources available to people so that they can get on this journey and stay on this journey.